Yeah, my name is Linnell, and I'd like to volunteer.
Well, what do you do? What's your occupation?
I'm a dental hygienist.
Oh, no. We can't use you. All you do is pull teeth.
You only pull teeth?
No, that's what you do.
No.
Oh, all we do is pull teeth. Sorry, I said it wrong.
Wow, okay. You mean, do you eventually leave them edentulous? Wow, okay, well, thank you. And that's how my very first phone call went when I called to volunteer the first time in my life, 20 years ago. Do you know that if you lose all your teeth, that's what edentulous means? You live a 10-year shorter lifespan? Because the more thoroughly you chew your food, the more surface area each of those particles develops, and the more nutrition your stomach can extract from it. Your digestion begins in the mouth, so you need to thoroughly mix it with saliva in order for your stomach to digest it. Your stomach doesn't have teeth in it, your mouth does. Your stomach is not like a garbage disposal where it finishes chewing up the food. It has to be done in the mouth. So the more teeth you have and the more thoroughly you chew it, the better health you'll have. Most people brush their teeth the same as they did when they were 3 or 4 years old. They carry into adulthood habits that end up leaving a lot of plaque on their teeth. This little boy was about 8 or 9 years old, and he left so much plaque on his teeth, I could draw pictures in it. Now, the bacteria not only smells badly, but it also causes a lot of problems. And that's because when we leave this plaque right along the gum line, which is where most people leave, they miss the bacteria, it divides every 10 to 20 minutes. One bacterial cell becomes 2, 2 becomes 4, exponentially. In 24 hours, one cell becomes at least 5,000 billion cells. That's a lot. Now, most people, when they're concerned about their mouth, they do a search on Google between 100,000 and 1 million searches every month for teeth whitening, and about 1,000 or a little more for brushing. People aren't so concerned about brushing, but that's where bad breath comes from. And that happens because, like I said, they leave bacteria along the gum line. So the picture on the left is one that I painted, and it shows healthy gum tissue. Logically, we tend to think the gums come up to the tooth and just attach, like this. But in reality, your gums come up to the tooth, dip down, and then attach, forming a sleeve or a cuff, like a turtleneck around the tooth. And it's inside that turtleneck, where the bristles typically don't reach, that forms gum disease. The bacteria on the wall of the tooth in this area actually start to form little ulcers on the inside of that turtleneck. And when you disturb it, that's where the bleeding comes from. And the tissue swells up, the turtleneck swells and gets really purple, and it bleeds easily. The bacteria aren't happy to just reside right in that turtleneck area. They actually start to multiply and work their way down the side of the tooth, and they destroy the socket because they go through the ligament, because your tooth doesn't sit smack against bone, it's suspended in the socket by little threads of tissue, so that when you chew, your tooth actually bounces up and down and moves side to side. It eats through that ligament, which is enlarged in this picture, and it goes right into the bone, and it eats away the crest of your little volcano that your tooth sits in. And with less bone around your tooth gets wiggly, and then it falls out. And then you get a response like what I did. All we do is pull teeth, because by then the gum disease has gotten so advanced. So let's do something to stop the advance of gum disease. If you go to the doctor's office, they'll take numbers. They should take numbers, measurements around to see how deep that turtleneck is. The measurement should be 1, 2, or 3 millimeters deep. In between the teeth, where your teeth are side by side, that little point of tissue is just a freestanding flap of tissue. So we want it about 3 millimeters high. Anything deeper than that, and we know that we've gone down into the ligament area, into the socket. These bacteria that get down into the socket and cause the bleeding and the disease, they actually get into your bloodstream, even without broken blood vessels. They'll cause a low-grade systemic inflammation of your whole body. They have found these oral bacteria, which are specific just to the mouth, in the clots of stroke victims. They've done a little excavation and opened up the clot, and they found the oral bacteria inside of that. In fact, there's been a lot of research around stroke, heart attack, diabetes, preterm babies, and low birth weight, and they have directly aligned and found causative problems between gum disease and those 5 areas. But there are many others that they've done some research on, but not so much, and they found a lot of association between gum disease and these other illnesses. Many of them are cancers. But if you think about it, it's just logical. If you have an infection somewhere in your body, right, that blood that's trying to heal that is flowing through your whole body. So it can cause problems elsewhere. So it's better to have, to prevent other possible diseases by having good oral health. A lot of people, when they think about decay, they think about the dental office, right? They think of the dentist. But they also associate sugar with tooth decay. But actually, sugar does more than just cause cavities. The sugar in your diet will displace vitamin C in your white blood cells. In order for your white blood cell to gobble up the bad guys, it has to have 50 times the amount of vitamin C inside the cell as around it. And the problem with sugar is that molecularly, it's very similar to vitamin C. So when you eat sugar, it goes into the blood cell, it displaces the vitamin C, and now that white blood cell is incapacitated, and it can't eat up the bad guys. But sugar does more than that. Sugar will cause the little hair-like projections on your throat to become immobile, and so they can't sweep up the viruses and the bacteria and things that you may inhale. And that's why your first symptom of getting sick is a sore throat, because it is allowed to multiply and divide and get really prolific in there. So it's very important to reduce the sugar in your diet. Now, I've also noticed that during the last 2 years, I've increased my intake of vitamin C, but I have a hard time swallowing pills. So I wanted to share with you what I do, because it's important to have high vitamin C content in our food that we eat. Bell peppers and strawberries, those are 2 that have a high content of vitamin C. But if you want to take supplements, I would get the powder. It's very tart, but it's easy to eat if you put it in applesauce or a little bit of juice or water. Some people like the chewable vitamin C, but there's a problem with that. The chewable vitamin C has a lot of sugar in it. And sugar, as you know, is what vitamin C is trying to fight against. These tablets, these chewable ones, have up to 8 times more sugar in it than the vitamin C itself. So it's basically neutralizing itself and not doing anything but giving you a lot more sugar in your diet, which is not good, especially if you're sucking on it. A lot of people think, well, I'm going to have orange juice because I feel like I'm getting sick. And this industry has done a really good job to lead us to believe that orange juice is high in vitamin C. Well, not as high as strawberries or bell peppers, but the fructose in orange juice is going to offset any benefit of the vitamin C that you would have in it. So it's better to just not believe that this is going to give you the vitamin C that you want if you're getting sick. Sugar is toxic to your bones. Now, if you've got gum disease and bone disease, that's important to know. Your bones are mended with the formation of collagen. So if you've got bone disease around your teeth, you want to have collagen forming, which is like a scaffolding for new bone to form around. But the vitamin C destroys the collagen. The sugar destroys the collagen, and it renders it useless for the body. And by the way, collagen is also what makes you look youthful, and it gives your skin elasticity. So I've often wondered why some people age so badly. And they may not be drinking, they may not be smoking, but when I learned this, I said, I bet it's because they have a lot of sugar in their diet, and it's destroying the collagen. I have a low white blood cell count, and so I don't eat very much sugar because I get sick right away. So I have a very low sugar intake diet, and when I saw this, I thought, oh, it's been beneficial all these years. So the other thing to know is that your diet will affect your bone health. Now, I've had a husband and wife team come in for their cleanings, and the wife has good oral hygiene. The husband has pretty good oral hygiene too, but they have completely different needs for me to clean their teeth. The husband is a lot of work, a lot of tartar on their teeth, and the wife isn't. And I ask about what they're eating, and although they're in the same house, they eat different diets. He's a meat and potatoes guy, and she's more plant-based. And that will affect how much tartar you have on your teeth and how much bone loss you have around your teeth, because the more phosphorus in your diet, the more tartar on your teeth. So in the Q&A, ask me about that, how that's related. Your bones store calcium, and there's only 3 places in your body that produce calcium as an adult. In the children, all the bones are growing, right? But in adults, only areas of trauma produce calcium. So if you're eating something that's taking calcium out of your bones, then you're going to have more bone loss around your teeth. The jawbones being number 1, then the spine, and then the head of the femur. I've had 2 ER physicians, and I've asked them, is it true that the head of the femur snaps off and then they fall? They said yes. So it's not always that someone falls and breaks their hip because it's brittle. It's the head of the femur. It's become so weak because their diet has pulled so much calcium out of their bones. And then, as I discussed earlier, gum disease also destroys the bones around their teeth. All right, so here is a calcium supplement that I would suggest if you're not already eating a lot of dark leafy greens, which give you they're very high in calcium, a lot of calcium supplements. So some bullet points to cover about the mouth. You have a 10-year shorter lifespan without teeth. 75 to 80% of adults have gum disease in America. It's up to 90% in Kenya, where I've been. Most people brush the same as when they were 4, and the average time spent brushing your teeth is 30 seconds. Okay, that's not long enough. Let's do better. Toothbrushes are kept 6 to 12 months on average. And what does the box say? Is anyone aware what the box says? That's right, 3 months. And I suggest you change your brush every 2 months, actually. And there's a reason for that. And the spinning round-headed brush that's popular, I see even now, I lost my bag. Answered a prayer, I got it back. But when I went to Indianapolis last week, I lost my bag in the Uber, and I didn't have a toothbrush. And so for the second time in my life, I had to go buy a toothbrush. And at the grocery store, they have these battery-operated brushes. They're not that good. I had a hard time. I almost bought a child's brush because they just didn't have regular toothbrushes. But a lot of these round spinning head brushes, they don't give you a good result. And that there are 57 diseases found to be associated with gum disease. So I want to share with you the SMILE system for brushing. I used to teach the 5 Ps, and they're hard to remember. Not even I could remember all the Ps. So I asked the Lord, I need something simple. And the very first thing that came to mind was the word smile. I'm like, smile? And that was all I got. And so I started mouthing what it was I teach people. I teach them where they need to start, and then how they should move the brush, and then they need to keep it at an incline. I'm like, oh, yes, I've been doing this for years and I didn't realize it. So where you start really matters. The enamel is the pretty part of the tooth. It's like white glass. Underneath enamel, the whole root of the tooth and under the enamel is made of dentin, which is yellow. So think about it. If you put a yellow light bulb behind white glass, it will have a yellow glow, right? The thinner that enamel becomes, the more yellow shows through because it's translucent. So where you start your brushing matters. because the toothpaste is more concentrated and therefore more abrasive. If you start in the same spot every single time you brush, which most right-handed people do, they start on the front or on the left, it ends up taking off the enamel. I've seen teeth worn square, like boxes, from brushing, scrubbing, because we're told to brush our teeth, right? We get in there and we scrub. And eventually, after years of doing this in the same spot every time, it takes off the enamel. And so logic says, put that toothpaste to work for you instead of against you. The back side of the lower front teeth is where you should start with your brushing, because everybody gets tartar buildup here. Under the tongue are two little saliva ducts right behind those two center teeth. And saliva is what carries the minerals, calcium phosphate, into the mouth, and that's what's sticking to the teeth. So, have you ever used Ajax or Comet or some kind of powdered cleanser where you sprinkle it on the counter or the sink and you begin rubbing? Have you noticed that where it's sprinkled, that's where it's the cleanest? Because it's more concentrated, therefore more abrasive. So start on the back side of the lower front teeth, and then how you move the brush matters. We're told to brush. So we get in there and we scrub and we brush, right? But the teeth being round will not allow you to get in between the teeth if you're using long brush strokes. You'll hit all the high areas of the brushes, of the teeth. So just work on two teeth at a time. Just wiggle so that you can agitate the bristles and get them in between the teeth that way. Just two teeth. So like you got two hands, two teeth at a time, about 5 seconds. So 30 seconds is not near enough time, maybe for one quadrant. And then hold your brush at an incline. The reason why these teeth end up being with the curve brushed right off of them is because people are pointing directly at their teeth. They're brushing their teeth, right? So instead of pointing directly at the teeth, you're using, the brush forms pretty much a flat surface, and you're pointing it at a round surface. It's only going to hit the high point of the round surface, unless you press really hard, which is not a good thing. So angle your brush, and then your bristles can conform to the curve of the teeth. So you want to incline the bristles down for the downstairs and up for the upstairs. So this is about a 45-degree angle to the long axis of the tooth. So 90 degrees is straight at, and for the upper tooth, you would get about halfway in between that. So up for the upstairs and down for the downstairs. So when I was at Indianapolis last week, I was the dental speaker. And the dental department is the highest demand area of the whole free clinic. My idea was, especially with the phone call, is to instead of giving them a fish, taking the tooth out, solving the immediate problem, let's teach them to fish. Let's give them some preventative care that they can take forward from them. So I made a whole website, and I want to encourage you to write this down, or take a picture of it, because the L and the E, I don't have time to go into today and cover everything else. So if you go to pathways.brushforlife.com, that will cover all the smile system for brushing and the GPS for flossing, which was another answer to prayer. Okay, great. So what I have done is wondered, why are we here? I've wondered sometimes when I'm really down, and I wonder, what's the purpose to life? Why am I even here? Does all this work to change the way the world brushes, does it even matter? I mean, really, seriously, when you think of the big picture, when I was in Kenya, we were in a tent, and I stepped out because of the time difference. They're 10 hours ahead, so it was the middle of the night, the moon had set, and it was a starry night like this. And I thought, I wonder if my camera will capture this. So I took my phone and placed the lens straight up and then took a picture underneath. And a really slow exposure. It did take a good picture. In fact, when I zoomed in, the areas that looked completely black actually had more stars in them. And the more I zoomed, the more stars I saw. And this was just with an iPhone. And it made me realize how insignificant and small we are. Except in the eyes of God, we're not insignificant. And so I've asked myself, what is the purpose of life? And I came to a good conclusion, I think. We're here for 2 reasons. And then I read in a book that I hadn't read in before. It's called Counsels on Diets and Foods. And do you know the first 2 chapters is not even about food? It's not even about diet. The first 2 chapters is on evangelism. And I found what I had concluded in the very first paragraph or 2. And this is it. Only one lease of life is granted us, and the inquiry with everyone should be, how can I invest my powers so that they may yield the greatest profit? And how can I do the most for the glory of God and the benefit of my fellow man? For life is valuable only as it is used for the attainment of these ends. Our purpose, therefore, in summarizing it, is to serve God and introduce others to Jesus. That's what I concluded. That's our purpose for being alive. Our duty is in the next paragraph. Our first duty toward God and our fellow beings is that of self-development. Who would have thought? Of self-development. There's the book. God requires the body to be rendered a living sacrifice to him, not a dead or dying one. Not a dead or dying one, which means like dead and dying tissue around the teeth. We need to take care of our teeth and gums. Seems insignificant, but he doesn't want us feeding our body with things that are not going to nourish it, right? That isn't going to render life to life. And it's as truly a sin to violate the laws of our being as it is to break the 10 Commandments. I was wowed when I saw that. I'm like, okay, so the health message is very important. The children of God cannot glorify him with sick bodies or dwarf minds. Those who indulge in any species of intemperance, whether in eating or drinking, waste their physical energies and weaken moral power. And as I read this, I thought to myself, this makes sense, because this scripture came to mind. In the last days, or as in the days of Noah, they were eating and drinking. Why would the Bible record that? Except that it affected their moral power. That had never occurred to me before. But the Bible makes mention of that. And then the Bible also says that as it was in the days of Noah, so today it would be just as important to guard what we eat and drink, because we are a living testimony. Whenever I go to a job, it isn't long before they notice what I'm eating for lunch. In fact, it's usually the first day. The second day that I'm there, then they want to know. They notice I don't have any meat in my lunch, and they ask, are you vegetarian? And of course, yes. How long have you been vegetarian? And then I get a whole list of questions. And that right there is a door opening for me to share the health message, which then always leads to something more. So just in your diet and lifestyle, you are a living testimony. Your health is at least your one talent. You know the story of the man with the 10 talents, the one with the 5 and the one with the 1? Some of you may think that, well, I don't have any talents. Yes, you do. You have at least your health. And how you live your life and how you take care and manage your health is a living testimony. It's your one talent. The question is, are you going to improve on that? What will you do with it? So I encourage you to invest in your one talent and share what you know. The more you learn about health, the more you have to share with others, just in understanding about health, the better you are able to serve them. Because I believe that as time draws to a close, how many of you think that we're close to the end of this world's history? Yeah, it's looking more and more like it. the more opportunities we will have to share the health message and the understanding of healthful living. And I believe that we should be the head and not the tail, as it says in Deuteronomy 28:13. Thank you very much. I appreciate your time and attention.